100.
The truth about being an orthopedic surgeon is it might not be as different from physiotherapy as you think. And by the end of today, I think you'll see why. So today, I'm lucky enough to be following along and shadowing an orthopedic hip and knee surgeon, and he'll be consulting people both pre and post-operatively. And we're doing it in style with a view from the SHARD, which is London's tallest building, and it's 310 meters tall. It's got everything from offices to hotels, restaurants even. And so it's actually so surreal because I get to walk past this every day on my way to work, and now I'm getting to go inside.
These days I don't take advice from anybody who gon' tell me how to do it if they never even did it right. These days I don't waste a minute of my time reminiscing on regrets of the past. That's a different life. These days I don't need nobody's validation. These days I don't need nobody's invitation. These days I don't tell nobody what I'm doing. I just do it. If I fail, keep it pushing till I get it right. Yeah.
Now, if we're being honest with ourselves, I think as physios, we view surgeons with this kind of aura, and they've got that kind of factor that like a professional athlete has. And I guess one of the differences that I've definitely felt is, as a physio who has to treat all different areas of the body, I've noticed that I don't get to specialize on one joint. And so the amount of detail you see these surgeons have on a joint or a specific body part is just next level. And they convey that to their patients, which ultimately leads to better outcomes, better understanding, and more trust from their patients. But while they have that knowledge, they're also using very simple terms and analogies to convey those ideas to their patients. I saw a really successful use of a hip model where they were showing a very osteoarthritic hip and how it moved compared to what a normal hip should look like, and then how they could do the operation to get to a more normal looking, smooth moving hip. And so that was really insightful to see, using models conveying clear ideas to get that across to the patient. And it's really encouraging when you just see that patient's face kind of light up with that understanding, because they've seen it on the model. They can now visualize what it would be like for them to have. Now, speaking of similarities between the professions, consultants have a schedule. Yes? A schedule, you say? Yeah, I mean, you know the one, Clinico TM3, a schedule. Oh, my bad then. I thought I'd been here a couple of hours. It must be my appointment soon. And since I've been here so long, aren't we still waiting for some people to subscribe, Matt? Oh yeah, that would be much appreciated. But all jokes aside, sometimes they will get a complex case and it will blow out a bit, or they'll have to even go to an emergency surgery that they have to perform. Typically speaking though, it will be a 30-minute initial consultation and a 15-minute follow-up consultation. Now, one of the things I really appreciated was the flexibility they have. And so if it's a more simple case and they get through the explanations, they just send the patient out the door, they're happy, they've received all the information they need. And that's one of the things I find a bit slow about physiotherapy. While it's great to have more contact time, it can feel a bit slow and you're just waiting sometimes for that session to finish, even though you've done your manual therapy or your exercises. So how about the treatment room setup? From the outskirts, it was pretty similar. You got a plinth in the corner that they'll do a bit of assessment on. You've got a screen that they look at their imaging, and of course, don't forget the view from the SHARD. So that's a bit of a difference to your normal physio room, but you're looking at a good desk setup. Now, I completely geek out on desk setups. I love a good custom desk. I love that each person can individualize their setup. So I've seen people use dual curved monitors where they'll have their notes and then the imaging. In this consultation, the consultant had their laptop facing them, a sideways screen where they could pull up all the imaging, and then desk and some comfy chairs to make a really good consultation. It's all about the environment and the feel to help comfort the patient. And then there's AI, of course, blowing up everywhere. It's getting used in more and more settings. And so the AI listens to the speech and the conversation, translates that into your notes, and then with a click of a button, you can have a letter or report done just like that. Send it off and you're done for the day. No extra notes, no extra letter or report writing, which is an absolute game changer. So there's a couple out there and I would definitely recommend checking them out if you haven't. And then you've got a variety of different treatment modalities. So obviously the surgery, I saw some injections get done and I saw one into the knee, and it was just interesting learning about the different angles and approach to get into the knee. So going from the soft triangle that's made between the top of the tibia, the bottom of the femur, and then the lateral fat pad, and you just go in there, direct it towards the knee, and that was the injection I got to see. And really, just having this knowledge helps you set any expectations. If you're recommending a potential injection, you know what the patient is up for, how easy or hard it is, and therefore how it might impact their recovery after it. And so where does that leave us? Of course, there are differences in the treatments we provide, whether you're doing injections or surgeries compared to different manual therapies and exercises. Really, it just comes down to taking a detailed subjective exam, a thorough objective examination to clarify the diagnosis and come up with a treatment plan that then needs executing and potentially collaborating with other health professionals. If you do this correctly, you get great outcomes for the patient. They're happy with you, they're happy with the surgeon. You've all worked together and produced an amazing outcome. If you're interested in this video, you'll probably be interested in my video of a day in my life as a London private practice physiotherapist. Catch you soon.